One of the hardest conversations that we have to face in medicine and nursing isn't actually telling someone that their loved one is dying. It's helping them understand that more treatment does not always equal more care. The moment the word hospice enters a room, usually you can feel a heavy wall go up. And I hear the same fears from families all the time. You've probably heard them yourself. They're giving up on my mom. Or worse, they're trying to speed up his death. And I get it, but that's not what hospice is about. It's not about killing anybody. It's about changing the lens and shifting our focus from fighting a disease at all costs to fiercely protecting somebody's comfort, their dignity, and whatever meaningful time that they're going to have left with the people they love. This is a conversation that I think every healthcare provider needs to learn how to do better. Not colder and not faster, definitely not as a checkbox on a chart, better. Because how we step into that room matters. Our tone, our facial expressions, and whether we pull up a chair and sit down or we just stand in the doorway. Um, and if the family does not feel rushed and feels heard, everything changes. And these aren't just medical updates. They're some of the most profound conversations that this family may ever have. The biggest misconception is that hospice means throwing up our hands and saying, we quit, and that it's abandonment. But it's not. It's moving the goalpost. Instead of thinking, what else can we pump into this person to keep them alive, we start asking, what can we do to make the time that they have left comfortable? How can we improve their quality? And families struggle deeply with this because that's the person they love. No one wants to walk away feeling like they signed a death warrant and stopped caring. Most families have not talked about this before. So suddenly, in the middle of panic and grief and exhaustion, they're forced to make brutal decisions about CPR, ventilators, feeding tubes, and it's a heavy burden. Our job as providers is not just to list options, but to guide them through darkness and provide them human compassion. So the main question that I get asked is, how do you know when it's time to have that talk? And for me, the trigger to bring up hospice is when we run out of options to offer a meaningful recovery or life after treatment. And not just survival, but recovery. And there's a massive difference. If a patient has advanced dementia, isn't eating, constantly confused and agitated, bouncing in and out of the hospital, infections and wounds, we have to ask ourselves, are we actually helping this patient? Or are we just prolonging their suffering because they're here and we don't want to have the talk? It's a hard truth to swallow, and sometimes aggressive medical treatment starts to look less like care and more like torture. Just because we can do something in modern medicine, it doesn't mean we should. And the reality of aggressive care is not well known. When families hear the phrase, do you want to continue treatment? They picture hope. They picture their loved one waking up smiling and walking out of the hospital. They don't see the ICU and the frail, terminally ill patient that's in that bed. CPR is not like it is on TV, breaking ribs, and life support does not mean breathing, breathing tube and they're good to go. It means restraints and sedation and poking and prodding, bright lights, confusion, distress. It all adds up. We don't tell families this because we don't want to terrify them. The family deserves honesty. They deserve the truth. A patient deserves honesty. And the golden question that seems to work for me whenever I feel a room getting stuck or indecisive and they don't know what to say, I'll ask them, if your loved one sat there, maybe they're 20 years younger or in their prime, or they have a clear mind, they could stand right now at the bedside and see themselves. What would they tell us to do? It usually will change the entire energy of the room. It stops being about the family's fear of letting go and puts the focus back where it belongs, the patient, their values, their dignity, their definition of a good life. And more often than not, the family already knows the answer. They just needed someone to give permission to say it out loud. Hospice is active care. I wish more people knew this, more providers knew this. Hospice is not the absence of medicine. It is world-class symptom control. It is aggressive pain management, easy anxiety, melting away the breathing discomfort. Hospice often cares for the family just as much as the patient because we know they're suffering too. They're tired and scared, and hospice can hopefully help carry some of that weight. I've watched families experience a profound sense of relief the moment that they step off the medical merry-go-round and see their patients relax in the bed. You can see the agitation relax and dissipate. Not because a miracle happened, but because the stress of constant procedures and hospital transfers was finally taken off their shoulders. Time matters, but peace and quality matters more. So if you're a doctor, a nurse, a practitioner, or anyone that facilitates these questions and conversations, please do not be clinical. Do not make this a transaction. Sit down in the room, slow your speech, and be human. Families do not need us to pretend that everything is fine. They need us to be honest. They need to know that choosing hospice is not failure. And sometimes shifting from fighting to comforting is the ultimate act of love they can give.